So I personally, just in case I'm in a hurry and I don't remember to identify if the patient's upright or laying down, if I don't see the gas shadows, then I put my marker down, laying down, so it's supine, and you notice I did it upright for the upright image. You'll find whatever works for you. Okay. Table bucky. So you have to make sure you have the receptor. Okay, just gonna get this out of the way for now. I'm gonna make sure I'm centered. Okay. All right. Okay. Do I start with my regular model, or am I having somebody else? Anyone?
You still need me, Miss O?
Yeah, model.
Okay, lay down on your back, please. Head on the pillow. Okay, good. All right, he scooted himself over. We have to make sure he's near the center as possible. Whenever you're doing supine, always go to the head, remember? Mid-sagittal plane, so I'm looking at the jugular notch down to the symphysis pubis. Okay? Since the patient has been disrobed, you do not go to the feet and check out whatever's underneath their gown and up to their neck. You're waiting for yourself to get in a lot of trouble. Okay? So when the patient is gowned, look at the mid-sagittal plane from the head. Okay? All right, so now we know he's straight. He's not tilted anywhere. Okay, I need your hands over your chest. Right up here for me, please. A little bit higher. Elbows out. Because remember, your diaphragm is going to be at the level of the xiphoid. All right? Table's moving. Let your patient know when you're moving. Okay, and I can look here until it's 40, or I can move it down to 40 till I detent. Okay? All right, I'm lined up. I've got the bucky, I've got the tabletop that's vertical, and now I'm going to palpate for his his iliac crest. So until you guys get used to it, the best way to start is making sure you're doing it bilateral. Because what that's going to do is put that in your head about trying to imagine what it feels like. So starting at the ribs, you go down to the side, and then you feel the top of the iliac crest. Top of the iliac crest, and I'm going to move down so your horizontal plane is at the iliac crest. Okay. And then I'm going to feel to make sure I get the symphysis pubis. The way you do that, flat palm. Notice, remember I was telling you about where your genitals are, right? Across from there, right, just slightly above, is going to be around where the greater trochanter is. So from anterior to posterior, your hand's going to go right exactly in the middle of the thickness of the patient's body. Flat hands, firm compression forward. I'm going to roll at the ankle and then feel for his greater trochanter, and it's right here. So now, if his greater trochanter is here, then that tells me where his symphysis pubis is. So I can actually move this up a little bit higher to make sure I even get the diaphragm on the same image. Here's my xiphoid. I'm going to get the diaphragm on this one. To help you kind of navigate on the table and trying to figure out if your patient's in the field of view, especially with this large body part, you can look at the top and then look at your ratios between the shadow and the side of the patient. But the easiest thing to do is, because not only are you looking from an angle, you have to be able to look from the tube. So when you do that, I'm going to feel for his ASIS on both sides. Now what I'm doing is looking at the border of the light and the border of the light here in relation to my fingers, this one and my thumb. So now I'm going to release the table without pushing myself on the table. And I'm going to get him and make sure that I'm centered on mid-sagittal plane, because now my light on both sides are to my fingers equally. Now I'm dead center. Because if I don't look at him straight on, I'm going to be 3 degrees off. If I keep going from the head and to the side, I've got the paddles over here, but I got to move there. So I'm going to be going back and forth like a robin, a lost robin. All right? Breathing instructions, breathe in, breathe out. Suspended respiration out. Okay? Your decube is not any different than the chest x-ray, just changes the 40 SID. Okay? If you are looking for the free air, then you're going 2 inches superior, like you're upright. If you're getting the entire abdomen, then you're staying at the level of the iliac crest. There's no change. Okay?